Let's study with me. Just listen and just gain something. This topic is viral hepatitis. Let's study viral hepatitis together. So before reading the viral hepatitis, what is hepatitis? Hepatitis is an acute parakinal disease of liver due to variety of cause in which variable numbers of hepatocytes undergo necrosis. So what is hepatitis? Hepatitis is an acute parakinal disease of liver due to variety of causes in which the variable number of hepatocytes undergoes necrosis. Due to the necrosis of the hepatocyte cells in liver, it causes parenchymal disease of liver. It causes hepatitis. So in hepatitis, there will be a depending on the onset and course of liver cell injury, hepatitis is classified into acute and chronic. So depending on the onset and the course of liver cell injury means when it starts and the courses of liver cell injury, how the liver cells got injury. With this, hepatitis is classified into acute, chronic, and this acute hepatitis. What is acute hepatitis? Acute means like in few hours, within few hours or few days or few weeks only. If it goes in within hours, days, few weeks, then it is a acute hepatitis. So, proper definition of acute hepatitis is acute parenchymal disease of the liver involving within hours, days to few weeks, at least 8 weeks. In 8 weeks is called acute hepatitis. So, hepatitis is a acute parenchymal disease of liver. Acute parenchymal disease of liver due to variety of causes in which variable numbers of hepatocyte cells undergoes necrosis, and depending on the onset and causes of liver injury, hepatitis is classified into acute and chronic. So in acute hepatitis is also a acute parenchymal disease of liver involving hours, within hours or few weeks or days. It's called acute hepatitis. So what are the viral hepatitis? Viral hepatitis means hepatitis that is caused by virus, and the hepatitis actually occurs due to the inflammation of the liver, means due to the necrosis of the hepatocytes. It causes acute parenchymal disease of liver. It causes hepatitis. So in viral hepatitis, it is caused by virus. So for viral hepatitis, let's see the definition. It is a systemic disease and it is primary inflammation of the liver due to heterogeneous group of hepatotropic virus. What causes the viral hepatitis? This hepatotropic virus causes the viral hepatitis. So, systemic disease. It is a systemic disease and it is a primary inflammation of the liver, and it is due to heterogeneous group. Means there is so many different types of viruses, right? This is due to heterogeneous group of hepatotropic viruses. So viral hepatitis is due to hepatogeneous group of hepatotropic viruses, and there are in viral hepatitis, depending on the types and causative viruses, acute hepatitis is classified as hepatitis A, hepatitis B, hepatitis C, and hepatitis D and E. So, depending on the types of the causative virus, means so many viruses causing us. That's why there is heterotropic group of hepatotropic viruses. So, depending on the different types of hepatitis virus, acute hepatitis is classified into acute viral hepatitis is classified into hepatitis A, B, C, C, and D, and E. So let's discuss one by one. The first one is hepatitis A. Hepatitis A is how it transmits. Hepatitis A is transmission through fecal oral route. Fecal oral route, and the incubation period is 4 weeks. It resolves spontaneously. It is caused by RNA virus. Means the genome of this hepatitis A is RNA virus. The nucleic acid is RNA virus, and this group A, there is due to heterogeneous group of hepatotopic virus. So there is different types of groups that causes hepatitis. So the hepatitis A is caused by enterovirus. This group causes hepatitis A, and the nucleic acid is RNA, and the size is 2.7 nanometer, and incubation period is 2 to 6 means 2 to 6 weeks, approximately 4 weeks, and it's spread through fecal-oral transmission, and the severity is mild. It can be prevented by the vaccines, and actively by vaccine, and passively by immune serum globulin, and prognosis is good. Compared to other hepatitis, the prognosis is good. Hepatitis A means it can cure better rather than other hepatitis virus. So the next is the hepatitis B virus. It transmits by blood transfusion, needle sharing, and unprotected sex. The incubation period is 12 uh, weeks, 12 weeks, and the variable clinical course rapid involvement of prolonged illness. There is a variable clinical courses is rapid improvement or prolonged illness. It can be a rapid improvement, and also the disease can stay for prolonged illness. And then risk of fulminant hepatitis, hepatic failure means it has a risk that can cause hepatic failure, means liver failure. If it causes hepatitis B, there is a risk of liver failure chances. The incubation period is 12 weeks, means the incubation period is little bit longer compared to hepatitis A. Hepatitis A is the incubation period is 2 to 6 weeks, and B is 4 to 26, means approximately 12 weeks. And it, the group that causes virus, hepatitis B virus, is hepa, hepadana. Means this group causes hepati, hepatitis B. So the nucleic acid is DNA virus. And next is hepatitis C. Hepatitis C is hepatitis C is caused by the group flavivirus, and the genome of this hepatitis C is RNA, and the incubation period is 2 to 20 weeks, means approximately around 8 weeks, mostly 8 weeks incubation period, and 80% remain asymptomatic and do not develop jaundice. So 80% shows asymptomatic and do not develop jaundice. The prognosis is moderate, and it can Prognosis is moderate. In hepatitis C, next is hepatitis B. Hepatitis B is caused by delta particles, incomplete virus, and the nucleic acid is RNA. And incubation period is 59 weeks. 59 weeks, and the size is 35 nanometer. The biggest size is uh, hepatitis B, 42 nanometer, and others are smaller size, 27 nanometer A, and the E hepatitis, their size is same, 27 nanometer. And C and G are almost same, 30 to 35 nanometer, D also 35 nanometer. And hepatitis B is the biggest, 42 nanometer. Hepatitis B is stimulation infected with hepatitis B virus and hepatitis B virus. The self-limited infection symptoms similar to acute hepatitis B virus. It's almost same. The symptoms are same with hepatitis B virus. And if there is a chronic, and it will be a more severe acute hepatitis, uh, chronic hepatitis B virus infections, risk of liver failure, chronic hepatitis, chronic active hepatitis, and cirrhosis of liver. So how it is spread. Hepatitis is spread by fecal-oral transmission, and from saliva also. And for the hepatitis B, the fecal-oral, from this fecal-oral, there will be no transmission, but the partial blood, penetrator blood, means from blood transfusion and all, it can happen. And then from saliva, and then sexual unprotected sex from this, and um, it can spread hepatitis B. And for hepatitis C, it also spread through the transfusion of blood, saliva, and hepatitis B also spread through blood transfusion and unprotected sex, vertical transmission, and from saliva, not from saliva, hepatitis B. And for hepatitis E, it can spread through fecal-oral transfusion and parenteral blood, means transfusion of blood, and vertical transfusion. From this, it can spread with hepatitis E. So how it spread? Hepatitis A is spread through fecal-oral transmission, and BCD, it spread through blood transfusion, then unprotected sex. And for hepatitis E, A and E, they are spread through fecal and oral method. A and E, they spread through fecal oral transmission. And other BCD, they spread through blood transfusion, and unprotected sex. And all the A, B, C, D, and E, these all hepatitis except hepatitis B. Others are RNA virus, and only B is DNA virus. And A is caused by enterovirus. The group is enterovirus, and C is flavivirus. B is hepatina, flavivirus, and then D is D for delta particle incomplete virus. And the biggest size is B. It has 42 nanometer, and hepatitis A and E are almost same. A and E are almost same size. 27 nanometer, 27 nanometer, and hepatitis uh, B is the biggest one, and C and D is 30 to 35 nanometer. D is 35 nanometer. C is 30 to 35, and D is 35. So A and E are same size, and B is 40 to 42 nanometer, and C is 30 to 35 nanometer, and D is 35 nanometer. D. Hepatitis E is acute staph limited illness, similar to hepatitis A virus. Transmission is of fecal oral route, risk is also having risk of hepatic failure, high mortality in pregnant females. The severity is often severe in B. B is the most severe, and C is moderate, and D is means unknown, and E is mild to moderate the severity. A is mild. The B is worse with age and debility. Next, let's see the clinical features. What are the clinical features? Means what are the signs and symptoms? Let's see. The signs and symptoms of the viral hepatitis. What we see is there is the person is suffering from viral hepatitis, we will see itching, and then yellow eyes, fever, and then clay color stool, pain in abdomen, dark urine. What are the clinical features? Again, let's say itching, then skin are having itching, rashes, and then eyes are yellowy eyes, and the stool also color is dark, no, no, clay color stool, and abdomen pain, and dark urine, fever. These are the clinical features, means the signs and symptoms. And then pathophysiology means how it goes wrong, how it happens. So in this pathophysiology, there are four types of periods, means incubation period. After this, it will show the patient uh, with this pathophysiology means how and why it goes wrong. How it goes wrong. So incubation period means asymptomatic and fixed infectivity. It will not show anything. Means in this incubation period, this incubation period is when the virus enters, and the period between the virus enters and first symptom shows in that period is called incubation period, but it will be asymptomatic. In this period, there will be nothing seen, like the patient is suffering or not. You will not see anything. Asymptomatic and peak infectivity means the infectivity is too high in this period. And prodromal phases. Incubation period, next is prodromal phase. In this, they will show fever, paralysis, abdominal discomfort. This In these phases, all the clinical features will be same, will be shown, like all the symptoms will be shown. Fever, malaise means the itching, abdominal pain, discomfort, abdominal pain or abdominal discomfort, and dark urine. Uh, and dark urine will show before jaundice. So all these clinical features will be shown in this period, prodromal phase, in this prodromal phase, and then ectopic phase. In the third phase, ectopic phase, the stool color will be clear color stool and liver enzymes will be highly increased. Liver enzymes secrete more and it causes jaundice. So before jaundice will be prodromal phase. The urine will be dark color and this ectopic phase there will be jaundice. Jaundice will seen in this period in ectopic phase. And the stool color will be clay color stool and liver enzymes will secrete more. And the next is the covalescence. Uh, it will show symptomatic resolution. The first one is asymptomatic. That period is incubation period. And the last one is the covalescence. It shows symptomatic resolution. Due to T cells activity and liver enzymes return to